All right, guys, we're back. Toxicology part 2. Let's talk about breathing them in. Yep. Yeah, especially for all my firefighter buddies out here that are in class. Yeah, this is kind of a big one. And this is why we probably shouldn't go running into places that have burning plastics. Burning definitely can get you in trouble. Can be self-induced or result of accidental exposure. Again, house fires or industrial accidents can be a good. And again, commonly abused inhalated toxins is paint, freon, propellants, glue, amyl nitrate, butyl nitrate, nitrous oxide. Okay, let's see here. I can speak of a couple of these. Yeah, they huff the cans of paint. They'll spray it and then huff the propellant from it. Yeah, some of the glues out there, well, yeah, they'll definitely knock you on your butt. Freon, I've already talked about that a little bit. Yeah, Freon guys, you start sucking on Freon, I assure you, yeah, you'll be flying like a kite, let me tell you. You will be definitely moving. You will get super dizzy. Again, it's not as bad with the synthetic stuffs nowadays, but it can happen. Okay, so again, it produces signs and symptoms of the respiratory tract. And again, patients who inhale the paint or propellants are usually called huffers. They huff gas also, by the way. They can use that. And by the way, that can lead to serious and very irreversible brain damage. It kills a lot of the nervous tissue. Pressings of pain in the upper lower lip should alert you to the presence of these. And again, any toxic substance, again, it produces a relative hypoxia. And any of these usually do that. They displace the oxygen, which causes the problem. And again, this one's kind of a generalized slide because they're going to be headache, confusion, dizziness, anything, again, hypoxia, okay? But by the way, these toxic chemicals can also damage the lower respiratory tracts as well. Hoarseness, stridor, the upper airways, lower airways, it can tighten them up. It can cause the fluid to leak into therefore causing rales or actually get so bad that they get rhonchus. Okay, again, if no oxygen to the heart, again, they're going to start throwing arrhythmias, okay? So the best way to handle these, again, safely remove the patient from the poisonous environment. Again, make sure that you've got adequate respiratory protection. If not, you're going to be joining the party of people that need to be rescued, okay? If it's safe to engage in a rescue, guys, this is why firefighters should be wearing their SCBA as they hit the door to get these people out. Remove paint and contaminated clothing. Again, fastest way to do that, again, strip them. All right. Again, primary survey, supportive measures, oxygenation of these patients, and then follow the protocols. Now, if you've got a surface absorbed toxin, again, many of these guys are these are your organophosphates, other toxins that can be absorbed. Again, first and foremost, wear your freaking gown and keep your protection clothing on. Yes, they can off gas, by the way, for these organophosphates. So just be aware of that. Don't go running them into the emergency department. They are going to require a thorough decon of these folks. Again, remove the contaminated clothing, and again, wear respiratory protection. All right. Perform your primary assessment, and then contact your poison control with that. Now let's talk about some specific toxins that you're going to run into, okay? And pay close attention to the variations in the treatments of this. I think that's the biggest thing here. So the good news is if we can identify the toxin. So number one, identify it if you can, all right? It makes a big difference on how we're going to treat these folks, okay? Carbon monoxide, again, it's a lot of the industrial, it's an odorless and it's a tasteless gas. Yeah, your red blood cells love carbon monoxide. That's the problem, is it doesn't like to let go of the carbon monoxide, and therefore it produces a relative hypoxia for the patient. Yes, there might be plenty of oxygen in their system per se, but it doesn't get to where it needs to go. And again, most CO exposures relate to the exogenesis causes. There's usually some sort of combustible item is the source of the carbon monoxide. We get this a lot, by the way, when we do the hurricanes, because people put the generators in their garage, goes out, eventually builds up in the house, and then boom. So again, methylene chloride is an organic hydrocarbon. It's used as an industrial solvent, which then converts to carbon monoxide after the liver processes it. Okay, so again, check out what it is that they're working in an industrial site. They don't understand why 10 people are fault. Well, that's because we got a leak of some sort of chemical. Oh yeah, and this breaks down once they gets to the liver. So CO actually forms the compound carboxyhemoglobin, which is actually what we measure with our little meters, okay? And then that it prevents the oxygen from binding to the hemoglobin, and then as those levels rise, the amount of hemoglobin saturation with oxygen actually greatly diminishes, okay? So again, it can only be removed slowly. And by the way, a little bit of trivia here. This is why the firefighters are on the 24, 48-hour shift. It was allowed so that the carbon monoxide could slowly diffuse out of the fireman's system. Okay, so that is the reason why that they were on a 24-48 cycle. Okay, and again, this is back before we had air mask. Okay, this is before we had our respiratory protection. So again, get them out again, and you just got to remove it from, it has to be removed from circulation. That's how we get rid of it. We can accelerate the process a little bit by putting them into hyperbarics, okay? And then when I say a little bit, it does speed up that process. But again, the best way is to get them to the fresh air, and then again, so the problem is that the myoglobin results in decreasing levels in the heart, and that leads to cardiac ischemia, and then that's where you get cardiac dysfunction with this. And then there's increasing levels of nitric oxide in the body, and it's highly reactive with many of our biochemical processes. Okay, so again, CO can mess you up pretty quick, all right? And then the thought of the cause of oxidative damage to the brain is probably due to delayed neurological sequelae, or basically there's a time delay that it actually causes the problem with them. All right, so yeah, by the way, a little reminder here: your carboxyhemoglobin, it does increase with the smokers. Actually, you want to have some fun. Put your MET scanner, your 5-gas scanner on the finger of a smoker patient. You'll actually see their carbon monoxide levels are actually probably up around 4, 5, 6. It's actually kind of scary, but that doesn't mean that they can tolerate it a little bit better because they're acclimated to it. So again, what are our signs and symptoms of carbon monoxide? Headache, dizziness, confusion. Again, it depends on how concentrated the carbon monoxide is. If it's too concentrated, then again, you can cause instant death. Okay? Yeah, something to think about before you're running into that fire. Yeah, if the levels are too high, gang, or all of a sudden you walk in and, hey, look at that, the cat's dead. The cat's dead over here, the parrot's dead over here, and then all of a sudden I'm dizzy. I don't know why. It's time to leave. It's time to get out of there. And again, most of our deaths from CO poisoning are due to, by the way, to ventricular fibrillation. One of the biggest things that I've seen with carbon monoxide is that when you get a firefighter that comes out of a fire, remember they've had a very heavy workload, but if they've had any CO exposure, that only makes it worse, okay? Now, so again, the respiratory alkalosis occurs from the hyperventilation, and again, in the severe exposures, again, your metabolic acidosis is going to be noted. And again, guys, it could also lead to multi-organ dysfunction syndrome, and the mortality rate with the mods when you get this, again, very, very, very high. So again, I can't stress about the CO enough. So again, what do we want to do? With these folks, we already talked about all this stuff. So what is it that we want to do with these guys? I think that's the key thing. By the way, elderly, young, old, hard-working firemen should definitely be on this list. Persons with heart disease, they're more susceptible to the CO poisoning. All right. Now, so again, a lot of times you're going to get there and they're going to look, I just feel like I got the flu. Again, it's often misdiagnosed again, and with your Rad 57 meter, it's very simple. Put that on, click over, see if there's any carbon monoxide in there. You might actually catch somebody that goes, "Oh yeah, wait a minute, we got a CO exposure here." Okay, so again, and hopefully, if you've got a monitor your cardiac monitor, some of them can do it. Most of them carry a Rad 57, which is the little handheld one, to find that out. So again, and this is an example again of the Rad 57. meter again. And by the way, this is actually a beautiful thing, but you got to know how to use it. And you got to know how to play with it. And again, remember that there are 4 different settings that you can cycle through to see what it is. Okay, because it measures CO, SO2, SpO2, methyl hemoglobin percentage, and then it also does your pulse rate involved with that. But you got to make sure that you've got it on the right setting to make sure. And by the way, the little dots over here are the ones that will tell you what you're actually reading at the time. Okay. Um. We talked about this already. I'm not going to go too far into that. Again, what is our treatment for our CO poisoning? Oxygen, lots of oxygen. You can actually use CPAP with a lot of oxygen. It can help a little bit. Supportive care for if they start having seizures, arrhythmias, or cardiac ischemia. And again, there's no research that demonstrates it, but they still do it a lot of times. It's not that you got a patient better outcome, but it helps reduce the carbon monoxide that's in the system. That's why they will do it. Okay, again, and it's usually for severe cases, and a history of the loss of consciousness with that is the big ones. And I can tell you, we did a lot of transfers down to West Palm via ground sometimes, because again, it was the biggest place where they had hyperbarics with them. So know where your hyperbarics are. Again, and this is an example, the one that's at the Johnson Space Center. So they actually will treat people, but remember, it takes a little bit of time to get them down to pressure. The closest, again, the one that's that big is probably West Palm. Now, but wait a minute, Scott, we got all these wound care treatment centers. Yep, you're right, absolutely, 100%. But that doesn't mean that they are that they're available for the use, for the hyperbaric use for carbon monoxide poisoning. As a matter of fact, most of them are not. Okay. Now cyanide, this guy, it's if it does have odor to it, it may have a little bit of bitter almond smell to it. And again, it's extremely toxic. It only takes a few parts per million to kill you with this stuff. And again, hydrogen cyanide is produced during your fire states, especially with plastics. Burning. Remember, everything pretty much is burnt. High levels of plastic, wool, silk, rubber, polyurethane, guys. These all produce the hydrogen cyanide. And again, don't breathe that crap, okay? Just don't do it, okay? Again, in the cyanide cellular toxin, it actually stops the energy production. If we remember for the citric acid cycle, it actually interferes with that, okay? So how do we take care of this? Again, number one, get them out of the toxic environment. Again, that's the biggest thing. And by the way, usually when you got cyanide poisoning, you're probably going to end up, if it's from a product of combustion, you're probably going to have CO poisoning in there as well. Again, headache, confusion, they're going to be combative. Remember, think of it as like their body's not getting oxygen, well, because it's not. And then again, seizures and coma, they develop a lot of pulmonary edema with this, and the elevated serum lactate, because again, they're going to have a metabolic acidosis to them. Again, remove them from the exposure, prevent them, and they do have some cyanide kits out there. The Pasadena Cyanide Kit, amyl nitrate they can use on these folks. And again, we usually don't carry them. Your hazmat team sometimes do, but again, if you have that availability, make sure that you've got those resources coming in a case like that. Anytime you got an SpCO greater than 10%, usually we will use the sodium nitrite is actually used with the CO and the cyanide poisoning kits. So just a little bit of trivia there, but that's one of those pieces of trivia they love to throw in is when do you use a Pasadena kit, or when do you use the sodium nitrite kits? Again, it's the CO poisoning is above 10%. Again, the cyano kit. Again, this is the stuff that looks like chocolate. It's carbaxylin is the preferred antidote, and actually, this works pretty good. There was a huge push years ago. Matter of fact, all these trucks were given a cyanide kit. Yay, wonderful, great, wonderful, until it comes time to replace them. And these kits are about $1,000 each, and all of a sudden, well, then we put it on the supervisor's trucks. But I think it is a very good thing to have, because especially if you have a firefighter that is in having a heart attack, there's probably a good chance that it's cyanide poisoning, and that was the big push a couple of years ago with these guys. Okay, regulate your heart function again, your vascular space, tone, your cardiac meds can cause all kinds of, we've talked about this during cardiology, but what happens when you take too much of them? And I think that that's kind of the key thing. Again, your beta blockers. Remember, we talked about that. It slows heart rate, slows force of contraction. What happens when you overdose on it? Calcium channel blockers slow down the speed of conduction, usually through the AV node. So what happens when you overdose on them? So all of these things can cause problems. Okay. And usually your cardiac medications, they can produce, one other one that I want to add to this little list here that you guys are seeing on the screen. The big one that I really want to add on this one is they actually are seeing halos around their eyes, especially digitalis. That one's kind of a big one. And for that, remember that I said that that drug has a very thin therapeutic index when we were in cardiology. Well, a lot of times people will overdose on it, and they will get, again, heart blocks, but they'll have this distinct, they see a ring around everything. So again, so it depends upon what it is that the medication is, and this is again, severe bradycardias may not respond very well to atropine. By the way, you need to start using a catecholamine when they have cardiac medication overdoses. Okay, external pacing might be an option there. Again, if it's a calcium channel blocker, again, in this your diltiazem, verapamils. These are, again, glucagon can be used. Calcium can be used for the calcium channel blockers. Glucagon is usually used for your beta blockers. And Digibind, this stuff, yeah, by the way, you don't want to be around about 10-20 minutes after you give Digibind, because remember when I said that the colon excretes a lot of the poisons in our system? Yeah, that one's one that they will start pooing everywhere, okay? So just be aware of that. All right, now we're going to hold up here after the cardiac toxins, and we'll see you guys on the next one.